The Connecticut Office of Rural Health is federally funded and is located in Winstead on the campus of Northwestern Connecticut Community College. The office is the voice for accessible quality healthcare for Connecticut rural residents. According to the Connecticut Office of Rural Health definition of rural, and using current census data, 61 Connecticut towns are designated as rural. This office serves as a clearinghouse for rural health information and resources. Through education, communication, and partnerships, the Connecticut Office of Rural Health focuses on promoting collaborations, assisting in coordination of activities, strengthening resources, and enhancing recruitment and retention efforts for healthcare providers. With this grant funding and efforts to enhance the access to quality healthcare, the impact reaches individual communities, hospitals, healthcare agencies, and emergency medical services.
Hi, I'm Dave Cadwell. I'm the coordinator at the EMS Institute at Sharon Hospital in Sharon, Connecticut.
My name is Arvind Shaw, and I work at Generations Family Health Center as the CEO.
Hi, my name is Donna DiMartino. I'm a nurse and I'm a hospice and palliative care nurse.
I'm John Goodman. I'm the Director of Communications and Development for United Services.
My name is Donna Grant. I'm the Executive Director of TEAG.
My name is Randy Daggett. I'm the Chief of Service of KB Ambulance Corps.
Hi, I'm Dr. Robert Bundy, and I'm the Medical Director here at Wyndham Hospital.
My name is Kathy Grimwad, and I'm the CEO of the Community Health and Wellness Center of Greater Torrington.
I'm Renee Clinton. I'm the Pulmonary Rehab Coordinator here at Wyndham Hospital.
I'm Sue Starkey, the Director of Health for the Northeast District Department of Health.
Our partnership with the Office of Rural Health in Connecticut has been really advantageous for us to take what we were doing in community programming and really advance it into more community health.
I have had the pleasure of having a long-standing relationship with the Connecticut Department of Rural Health Healthcare in Northwestern Connecticut, and we've really worked with them for years to help establish the first community health center that is federally qualified in the entire Northwest region of Connecticut.
Part of the Pulmonary Rehabilitation Program is our Better Breathers Club. That Better Breathers Club is supported by a grant from the Connecticut Office of Rural Health, and without that we probably wouldn't be able to offer our services to our patients in this rural area of Connecticut.
We're here to support the 16 volunteer ambulance squads that report to our hospital. Our system of emergency transport is all volunteer. So if you dial 911, one of your neighbors will show up to get you to the hospital. We've had the privilege of working with the Connecticut Office of Rural Health, mainly in leadership training. The New England Council for EMS has a fabulous leadership program that they have supported over the past 4 years, where we bring in EMS leaders to get great training in leadership, finance, recruiting, and retention.
There is a national certification that is available through the National Hospice and Palliative Care Nurses Association, and it allows nurses to learn very well all of the topics that are needed when someone is sick and in the process of leaving this world. So I went to the Connecticut Department of Rural Health when I had this idea that they fund a project where myself and 2 other RNs, 1 LPN and 2 nursing assistants take time from work and get the materials that we needed to study for an exam. And they were wonderful in helping us to do that, and all of the nurses who took the course and all of the CNAs or the home health aides who took the course all passed this exam, which is a national certification and is something that we're all very proud of.
So one of our tactics to try to help the community help themselves is to employ a training called mental health first aid. And what mental health first aid really is the CPR equivalent of mental health. A good analogy is the fact that if you were in a crowded restaurant and you saw someone choking on a piece of food or in the midst of a heart attack, you would probably have about 20 good Samaritans running to try to help that person. Now, if you had an individual in that same restaurant that was exhibiting signs of being in the midst of a mental health crisis, you probably have those same 20 good Samaritans run the opposite direction. And that's not because they're not good people, it's just simply because they don't know what to do and they're afraid of making a mistake. So mental health first aid really is designed to give people the training to equip them to try to help someone who might be in the midst of a crisis, to try to keep that situation calm, diffuse the situation until some professional assistance can be obtained. Now, thanks to the Connecticut Office of Rural Health, we've received grant funding for the past several years to try to reach out to some very important target audiences in the community. Audiences like EMTs, who often encounter individuals who have mental illness or are dealing with addiction or substance abuse, and to try to provide them with the skills to diffuse a situation, to try to help that individual and to bring them to the appropriate provider so that they can receive the care that they need.
Most recently, they gave us money for the HealthQuest Collaborative to do CPR and automated external defibrillator training in an effort to increase the number of Connecticut towns that are certified as heart safe by the Connecticut Department of Public Health. This is really great news because it means that if there is somebody who suffers a cardiac event, there's a greater likelihood that there will be somebody there, somebody in running distance who can come and keep them alive until help advanced medical care arrives.
One of the funding streams that we got was to start our behavioral health program. And we used the funds, and it helped us to launch what is now a pretty large operation for our behavioral health services. It was kind of fundamental because it allowed us to gather the data, do the needs assessment, and then launch it. Another way in which the Office of Rural Health has helped us has been in providing dental care. And they provided us with the initial funding to do the necessary studies and the community work so that we could get our Across the Smiles dental van on the road.
The latest impact Connecticut Office of Rural Health has made in Northeast Connecticut is a grant awarded to NDDH as part of a program called Follow the 50. This is a program that involved women that were at risk to have heart issues and how they can reduce their risk by making better choices in life, from eating choices to exercise.
The staff of this office were really essential to us because they provided the leadership and the data and the health assessment of the region to really substantiate what we had in Northwest Connecticut, and then as part of the planning group to determine how were we best going to meet their needs. So our organization, starting with in a donated space of 2.5 exam rooms, has grown into a full-fledged community health center with 12 primary care exam rooms, 6 dental chairs, and behavioral health. And all of that was done with all of our partners, and one of the most essential partners being the Connecticut Department of Rural Health.
I want to thank the Connecticut Office of Rural Health for their grant. It has opened up the opportunity for people living and dealing with chronic lung disease in the outlying areas to come to Windham Hospital and to be able to be informed of the programs that we have to offer here. It has increased their knowledge of their respiratory disease. We've taught them how to have a healthy lifestyle with diet and exercise. In addition to living with chronic lung disease, there's also the social aspect of it. They were able to have a social worker come in and could speak about some of their concerns, and it was very beneficial for them.
We've been able to put on some small programs with the support of some mini grants from the State Office of Rural Health that have really helped us focus on mental health for children, increase the capacity of the community to deal with children who have mental health problems. We recently conducted a training for all the community people who touch children's lives in a way that they might interact with a child who has a mental health need but have not had the skills or the education to prepare for that. We had bus drivers and Sunday school teachers and Boy Scout leaders come to this training. It was a small event. We were planning to put it on for about 10 people. We had 13 participants over the 2 nights of the training, and we really feel like we've gone a long way with that small effort to really advance the capacity of our community to help children who are struggling with mental health needs.
We have taken the funding and expanded it beyond the local area that it was used in to be used throughout Northwest Connecticut, which was really the goal in the first place, that we expand the knowledge of nurses and healthcare providers in our community.
It's, again, the epitome of accessibility to services that we already had, but we can only do so much with in terms of providing that to the public in a rural setting without the support of services such as what comes from the Connecticut Office of Rural Health.
It's building upon the study that was conducted, and you can't be confident until you look at the data, and it's only after you look at the data and you analyze the data that you see its importance. But it does make a big difference when you've got this seed money, and you may think it's a very teeny tiny piece of funding, but when you magnify its effect, it's very profound.